Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast is part of the cluster. This podcast is part of an overview for the IBMS Awards 2026 and the category in around the category partnership working, and this audio podcast as part of a Storm Robotics production. So as part of this audio podcast, one of the initial questions as part of this category, why was the partnership formed, and what were the aims of the partnership? So patients and carers often have various questions related to kidney care following routine clinical appointments, for example, and the RPSG, the Renal Patient Support Group, and the Kidney Disease and Renal Support Group, or KDOS Group for Kids, social media platforms that have linked evidence-based and scientific practices, so, and scientific practices to support adults and pediatrics and young people suffering with varying forms of kidney disease. So the two social media platforms had a basis to have a sort of an effort to as an effort, a sort of collaborative effort, but also a part of a sort of partnership effort in at least aspects or elements of the works. And the role initially consisted of providing lecture and workshops more specifically surrounding immunology and hematology subjects, and duties had also included mentoring and external supervision of undergraduate research candidates in keeping with kidney care works and public health and healthcare sciences and research practices, including mixed methodology in co-developing webinars and podcasts. Involvement initially also included, or partnership or efforts have also included external academic and mentoring and supervision. And since there was preliminary academic involvement at an academic institution in the United Kingdom, there was then this basis to see about whether there could be an opportunity for blood sciences and pathology and laboratory medicine audio podcast channel Storm Robotics to encourage best practices where students had opportunity to develop peer-reviewed manuscripts for publication or for and in round for peer review publication as part of undergraduate and postgraduate in in biomedical sciences and pharmacology under mentorship and supervision. The partnership effort would also be in keeping with co-developing collaborative efforts with the social media platforms. And so with over several decades or 2 decades of experience of healthcare and scientific experience, the history of publications, including developing different forms of publication, there have been a partnership effort with the School of Sciences and in around health and care at the academic institute at one of the academic institutions in the United Kingdom to bring this partnership initiative into fruition. So, in as part of the second question, as part of the second question, in relating to this category and around partnership working, um, describe the work that the partnership had carried out. So the academic institution has several undergraduate and postgraduate programs in amongst the sciences and in amongst pharmacology. From 2024, there have been some discussion with academics, but mainly with one of the main academics within the Faculty of Healthcare and Science, within the Faculty of Health Sciences, within the academic institution, and where the discussion was to see about placing an initial post on a digital bulletin board, and in relating to in regard to You see, if students would like to attain some experiences in and around research writing and to envisage that manuscripts are prepared for peer review and publication. It is from this understanding that students were assigned into cohorts to develop a manuscript surrounding and across different themes of sciences, but also in a line to where manuscripts would be sort of developed or co-developed in around linking sciences and pharmacology. And students had timelines to finalize manuscripts, and additionally had been and additionally during in that duration, MS Teams meetings had been organized at various time points as various time points of time, so that students had opportunities to go through writings and ask any questions. Between the the different manuscripts that were assigned to students and student cohorts, there were 30 students who initially expressed intrigue, 29 who formally participated, and where three students were signposted to the academic institution from a second academic institution within from the a second academic institution in the United Kingdom. And um, the research writing process involves a student receiving an outline of four different works or different manuscripts, in addition to initial drafts, which had all been developed in collaboration. Had been developed in initial collaborations, sort of retrospectively, and in amongst works between the social media platforms, sort of retrospectively. Draft manuscripts or works were then shared with students. The students were all then given some ideas of some similar works that had been published, so they could get an understanding of what published works would and should look like. The partnership also involved students being signposted to the works of the RPSG and KDAR's ResearchGate pages or ResearchGate page, where they could attain an understanding of generic scientific portfolio. Both social media platforms have provided multidisciplinary team working perspectives between healthcare sectors and in various settings, research, for example, in amongst research and industry. And it was then students began developing works under the academic one of the main academic institutions in the United Kingdom, the two social media platforms, and Storm Robotics Productions accordingly. So, in around the third question under this category, and as part of the IBMS Award Partnership working in 2026, the question is in around describe the work that the partnership sorry just in around um, in around the third question in around this category is what outcomes were achieved where possible you utilize quantifiable data. So as per mentioned, there were 30 students who initially expressed entry, 29 who formally participated, three of which had been from a second academic institution in the United Kingdom. The manuscripts that had been developed and co-developed between the main academic institution and in around the main academic institution, and also aligned to where drafted works were from or had been from Storm Robotics Productions, but also in around between sort of retrospective collaborative works from and between the social media platforms, and these included that of included in around for example, coping in young people and in looking at immunology and neurobiology, where there were a number of students. Secondly, in around sickle cell anemia and thalassemia, where there were a number of students, and Crouzon syndrome, again, where there were a set number of students. In around Huntington's disease, there were a number of students, and then in around sickle cell anemia, thalassemia, there were a number of students. Myasthenia gravis, again, there were a number of students. And in looking at endogenous opioids in ischemic preconditioning, there were a number of students. And then looking at stratified receptors and early transplant immunobiology, where there were a number of students, and then looking at the use of social media and aspects of transplant immunobiology, there were a number of students also. And so the outcomes that were achieved from this were that the students had formally formed a peer reviewed or drafted manuscripts that were ready, that were organized for peer review and publication according to particular scientific and or medical journals. Um, and um, uh, and uh, and so in addition, there were several research poster presentations that had also been formed as part of one of the sort of outcomes for and as part of this partnership working. So then looking at question 4, IBMS award, around this IBMS awards and partnership working in 2026. The question 4 is, why does your partnership deserve to win this award? So the partnership between the academic institution in the United Kingdom, the two social media platforms, and Storm Robotics Productions have been a first pilot where biomedical science students, biomedical science undergrad and postgrads, and early pharmacology postgrads had developed manuscript works that allowed them early exposure to academic works, academic and research writing works. This offered students an opportunity to learn different elements of blood sciences, pathology, and blood sciences and pathology, and amongst blood sciences within curricula that is aligned to, in keeping with the National Health Service or NHS laboratory practices. In addition, students having developed peer review works, this allowed them to attain understanding of how the RPSG and social media platform, RPSG and KDAR social media platforms, for example, have also been developing best practices for online healthcare service users, or for healthcare service users, over 10,000 healthcare service users in around the RPSG, and in around over 2,500 over 2,000 or 2,500 healthcare service users in around the KDAR social media platforms globally. And in keeping with best practices, or developing best practices, this partnership allowed working collaboratively with Storm Robotics Productions, which is an audio podcast platform that has over 140 audio podcast series surrounding blood sciences, pathology, and laboratory medicine. Storm Robotics Productions has also been an audio podcast channel between RPSG and KDARS for kids social media platforms, highlighting how patients or healthcare service users, professionals, and researchers who look to prompt best practices and encourage who look to prompt best practice can collaborate and encourage a better world. And throughout the several audio podcast series, there has been an effort to highlight how the academic institutions, works, how the academic institutions work to prompt best practices and additionally again sort of encourage sort of collaborative working and the academic institution additionally with the social media platforms in and with the social media platforms in collaboration with Storm Robotics Productions deserve to win this award. So that draws this audio podcast to a close. This audio podcast is part of the cluster. This audio podcast is part of the IBMS Awards and in around the category Partnership Working 2026, and this audio podcast as part of a Storm Robotics production.